Good morning, everybody. Welcome to the Florida HIE Services webinar on the Encounter Notification Service. On behalf of Florida HIE Services, I would like to thank everybody for calling in and watching the webinar today. Today's webinar will feature an overview of the ENS service as well as a live demonstration of the Prompt user interface. Prompt is a free web-based dashboard that can be used to get the most out of your ENS notifications. My name is Chris Wilkie, and I'm the Health IT Outreach Specialist here at the Florida HIE. I just want to let you know that today's webinar is being recorded, and the slides as well as a link to the recording will be sent to you after the webinar concludes. We are also reserving a little bit of time at the end of the presentation to take your questions. There are two ways you can ask those. You can either type them through the GoToWebinar dashboard, or you can click raise hand and we can phone your question in and you can just do it verbally. Before we get started, just want to give you a little bit of background about the Florida HIE. The Florida HIE was founded in 2011, and it's been facilitating the secure exchange of health information through several services between healthcare providers, hospital systems, and payers. The service that we're going to be highlighting today is the Encounter Notification Service, and ENS is a valuable tool for providers for reducing readmissions, improving care coordination, as well as improving patient satisfaction. Before we get started, I want to take a poll and just ask a couple questions so we can gauge who knows about ENS and maybe if you've seen any of our webinars in the past. The first question, which will appear on your screen, is have you attended a webinar or heard a presentation about ENS in the past 6 months? And you can just either click yes or no. I'll give you a minute or so here to respond. Have you ever attended a webinar or heard a presentation about ENS in the past 6 months? All right, just a couple more seconds here. So it looks like about 80% have not. So I'm glad. Welcome all you newcomers. Hopefully we got some good information for you this morning. All right, our next poll question is your organization a data source to the ENS? And a data source would be an organization that's sending data. Is your organization a data source to the ENS? All right, looks like most people have sent in their response, and wow, we have 45% are data sources. So that's great. I'm glad to have you on the call this morning. All right, last poll question before we get started. This one is your organization a subscriber to ENS? So that's for those of you who are receiving data. Is your organization a subscriber to ENS? Are you receiving notifications from us? All right, looks like we've got everybody has their vote in, and only about 35% are subscribers. So for those of you who are not, you're going to get a lot of information this morning. The prompt demo will be really nice for you to see how the notifications can be organized and how you can use them. So without any more delay, let's go ahead and get started. So in this morning's webinar, we're going to have two guest speakers. We've got Pamela King on for AHCA. The Agency for Healthcare Administration governs the Florida HIE by setting policy, convening the stakeholders, providing oversight and engaging federal partners. Pam King is our Health Information Technology Outreach Coordinator. Good morning, Pam, and thanks for being here.
Good morning, Chris. Thanks for having me this morning.
Sure thing. Do you just briefly want to tell everybody your role at the agency and how you interact with ENS?
Certainly. So I am the Health IT Outreach Coordinator, as Chris mentioned, and I share information about the health IT initiatives that are under the auspice or governance of the Agency for Healthcare Administration, which includes Florida's Health Information Exchange, and of course, the Encounter Notification Service, or ENS, is one of those services, or the main service for the Florida HIE. And so what I do is share information through webinars like this and speaking to organizations and speaking with organizations directly.
Awesome. And secondly, we have Erin Parsons. Erin is a manager at Audacious Inquiry. Audacious Inquiry is the other half of Florida HIE Services. They contribute innovative technology and strategic insight, and they also manage the day-to-day operations of the Florida HIE. Good morning, Erin, and thanks for being here as well.
Hey, good morning, Chris.
You want to tell the audience a little bit about yourself at Audacious Inquiry and how you deal with the ENS service?
Yep, absolutely, and thanks for having me on this morning to talk about Florida HIE and ENS. My role with AI, or Audacious Inquiry, is as the outreach manager for the Florida Health Information Exchange. So similar to Pam, I spend a lot of time working with our existing and potential clients to explain to them the benefits of ENS, or the benefits of participation in the other services offered by the Florida HIE.
Excellent. Glad to have you both on this morning. And with that, Pam, I'm going to turn it over to you, and we can give everybody a little overview of ENS.
Great. Thanks, Chris. And thanks, everybody, for joining us today. I know a lot of people are preparing for Thanksgiving and the upcoming holidays and Black Friday. So getting your running shoes on and prepping for meals, getting the baggy pants out, hopefully. I know there's a lot of people in the Big Bend area that are going to have a little bit rougher Thanksgiving. So those of us that were not affected by the hurricanes can be very thankful for that. And we're very thankful for those people that are in that recovery mode. And hope they have a really great Thanksgiving. But now to what we're here to talk about, our Encounter Notification Service, and just kind of an overview of the service and what it is. It is basically an alerting service, and it provides information about a patient's encounters at over 215 hospitals in the state of Florida, and that's both inpatient and emergency information, and it's in real time, or as near to real time as you can get. I guess there's a couple of seconds there that it takes to feed through. We have 95% of the acute care hospital beds that are sharing this information, so that's a significant coverage of the state of Florida. I laugh when I talk about the number of subscribing organizations, because we go 78 subscribing organizations, and people are like, 78? That doesn't seem like very many. But when you take a look at the reach of those organizations, these are organizations at a higher level. When we have health plans, we have ACOs, primary care providers, hospice, hospital systems. So we have over 50 hospitals that are actually receiving data back. So some of those hospitals are sharing data or getting that information back. And since sounds like we have a significant number of hospitals on the line, it's really beneficial to know, if a patient is seen at your facility, are they seen at another facility a week or so later, and why? Once they were released from your hospital, why did they go to another facility? So it's really important to know that. And primary care providers are also getting this information through some of our subscribing organizations. Well over 10,000 primary care providers receive information from these alerts from health plans that they work with, ACOs, larger primary care organizations, practice organizations. So we're really excited about the benefits that we're hearing and people are deriving from the encounter notification service. We have actually over 8 million lives covered under this service, and we are providing over 1 million alerts a month on these patients. So there's a million alerts a month going out to folks, letting them know what's happening with their patients when they're being seen at hospitals. You can get a complete list if you want to know, hey, what other hospitals in my area, or who is sharing this data. A full list of those participants can be found at our website. And at the end of our presentation, while we're doing Q&A, I know Chris will put up the contact information for you, so you'll have that website address. And you can also see other participants, other subscribers to the service as well, to let you know what's going on and who's sharing information. So, Christy, I'm going to change just a little bit about how it works. So if you subscribe to the ENS service, you would provide us with a patient panel with basic demographic information, and we take that information and we match it to information being sent from the hospitals. And if there is a match to your patient, you would get a notification back to you. This is like the high-level, super simple way to say it. There's a lot of stuff going on in the background that's very complicated that I don't have any business talking about. So super simple is, if it matches, you get it back, and you would know if your patient was seen at a hospital. Unmatched data sent from the hospitals goes off and is disposed of in the never ether land. We do not maintain data except for in certain circumstances where we have been asked to by a data source. And when and where and how you get that information, whether you receive it really in real time or whether you choose to select to get it at certain times of the day in batched deliveries, depends on you and what you want to see as a subscriber. Next. Here's just kind of a shot of some of the key information that is received in the alert. So you would get the name of the patient, where they were seen, who their insurer is, and then discharge disposition and diagnosis code. Now, I will say that some of these are iffy, and I'm going to ask Aaron to jump in when I get this right or wrong. I think it is with discharge disposition, Aaron, is that correct? That sometimes we don't have all the information for that?
So, right, discharge disposition and discharge diagnosis aren't always available and coded by the hospital and sent to us right at the time of discharge. We do receive those sometimes a little bit delayed, and where we can, we fold them into the notifications. Right, so we send the data out to subscribing organizations, to participants that are receiving it. We're sending what we get from the hospitals. And we do our best to make sure that it's populated as much as possible, but we don't have whole control over that. And so sometimes, not everything's going to be populated 100% of the time, but I think we've done a pretty good job of getting those numbers to a good place and continuing to work with our connected hospitals to make sure we're improving on that as well.
And as I mentioned, you as a subscriber, you can determine how you receive the information. There's a couple of different ways, and we'll talk about that, and how you can receive the information and how often you receive that information. And so I mentioned kind of briefly that you can get it in real time. So you could get a notification sent to you through your direct email or through a portal in real time, or most of our subscribers choose to receive a batch of alerts a couple of times a day, in the morning and afternoon, so that they have that information and they have it in enough time that it's actionable. If you want to go to the next slide, Chris, and you can determine how you receive that information. You may want to receive information through direct messaging. So if you have a Direct Trust certified email system associated with your EHR system, you can have the alert sent to you or to your direct messaging box, or the direct messaging box for your organization, administrator of your choosing at your organization. Or the next slide, Chris, you can establish an secure portal site, an FTP site, either on your end or our end. So you can go into a portal and pull down information from the portal. And then last but not least, and what a lot of you are here to learn about today, is the prompt interface. You can get information through, at no additional cost, through the Florida HIE's prompt interface. And this is just a really nice, clean way to look at this information. It is a portal, so you go out to the portal. It's just, we've laid an interface, user interface over the top of it so that it's much easier to see and read. And what we want to do today is, Aaron, we're going to give Aaron control of the monitor so that he can walk you through a demonstration of what this prompt interface looks like and how you can use it to benefit your organization and your patients. So Aaron, I'm turning it over to you.
All right, Aaron, are you ready for me to switch over to your screen?
Yes, sir, absolutely. All right, so I have been made the presenter and I can go ahead and show my screen. So first thing I want to touch on before we do the demo is that this is a test account. This is just a demo account. It's not real data. This is not real PHI. And I may say that a few more times during our conversation here, just to reiterate and remind everyone, test account, not real PHI. But this is very much what the data would look like coming through on your end as a potential subscriber to the service. So we've been talking about ENS, about getting encounter notifications. You know when your patients have gone to the hospital in real time, and all the great care coordination activities that can enable to allow you to provide better care to your patients. And as part of that process, getting people set up with the service is the question of how the notifications are delivered. And Pam talked a little bit about direct messaging or SFTP. We can do that. But there's a third option, which is our proactive management of patient transitions tool, or prompt. It's our web portal. So you can log in and access your notifications via the web. So there's a number of tools here that make it a little bit, or that provide you the ability to kind of work the notifications and have a lightweight care coordination tool. Now, if your organization already has a platform that lets you do this, or you have another vendor that you work with that has a number of tools that allow you to work through data that provides care coordination capabilities to you, that's great. We're happy to work with you, work with them to use ENS data as an input to that process. But what we found is that a lot of provider organizations, ACOs, payers don't necessarily have that tool set. And so we have been telling people about prompt and about kind of the functionality that it offers to let you work through the notifications and actually work the data. So we provide the data, but we also provide a tool set if you need it, to access and go through your notifications. So just one option among several for accessing the data. And in Florida, we do offer this at no cost. So it's kind of wrapped in with the overall cost for your subscription to ENS. So this is just one of several options, and how you choose to access it doesn't impact your costs. So this is just an extra add-on if you need the tools, and they're kind of nice to have. So when you log in, this is the main user interface when you first log into the account. Again, not real PHI. And on your left-hand side, you'll see the queue of notifications. So these are the alerts that have come into your account. If you have 3 prompt accounts for your organization, then all 3 of you are going to see these same set of notifications on the left-hand side. And you'll notice that the queue on the left-hand side is divided into 4 tabs. One is all, and that's clearly where all of your notifications are going to populate. And then it's divided into kind of subfolders of not started, which is by default, they're all categorized as not started, in progress, and completed. And I'll talk a little bit about how you can use these different statuses to communicate with other team members who also have prompt accounts. So first thing we'll do is let's go ahead and find Mr. Gibbs here. I like this notification. It has some good features that make it a good notification for a demonstration. So, and that demonstrates actually the first feature, which is the search feature. You can search by name or MRN to get right to a notification you're looking for. And I wanted to look at Edward Gibbs' profile here. So you'll see when you click on the notification that it provides you information about the patient and about their hospital encounter, where it occurred, and some basic ADT-based information about their encounter at the hospital. Basic demographic information that the patient provided at intake at the hospital, date of birth, gender, address, city, state, primary telephone number, and then to the extent that it's available, additional information about the patient. So their attending physician at the hospital. This actually says primary care provider. I think that's in here as a custom field. We can touch on that as part of this conversation too. But then there's information about the hospital where the encounter occurred and about the encounter itself. So the facility, the patient class, whether emergency or inpatient. For ENS, observation and outpatient are both out of scope. So all the notifications at present that you see in prompt are either going to be emergency or inpatient. And then event type, whether it's an admit or a registration or a discharge, the admit date and time, discharge date and time, the patient complaint. So this is a free text field that the registrar in the emergency room or at the hospital is going to enter. But you also receive the discharge diagnosis, both as a code and as text. The admit source, discharge disposition, that tells you where the patient went when they left the hospital. They may have been discharged home, to an assisted living facility, an intermediate care facility, left against medical advice. Right, it just tells you after their encounter where the patient went. So all of this information that you're seeing thus far about this patient, about Edward Gibbs and their encounter at the hospital, is the same information that you would receive if you had a direct account or you had SFTP, right? This is the same basic information about the encounter that will send to any endpoint that you choose. But among the tools that are available in prompt are some information about prior encounters for that patient, and then also a status log, and I'll talk about both of those. So the event history, we'll just go right to the bottom here, shows you earlier notifications from that patient. So it provides you an acute care clinical history for that patient. So it allows you to see prior encounters that often can shed some light on the current encounter and on the current notification that you're looking at. So this patient had some earlier emergency department encounters at a couple of different facilities. You can click on those and see the same kind of information that you have about the current encounter. For this example, it doesn't look like they have clinical relevance to their current encounter, but I'm not a physician, they may. So But you can see date forward from the time that you set up your account. You can see prior encounters for that patient. So that's an exciting and useful feature of Prompt. And then you also have the status log, which tracks the patient's movement through these different statuses. So I noted before that everyone by default, as their notification comes into the queue, is listed as not started. And then you can move them by using these buttons right here to the various statuses. So let's say Edward Gibbs had a hospital encounter. They were discharged from the facility, and we've reached out to that patient and made a follow-up appointment. Let's say this is a Medicare patient. We're going to do transitional care management, which is a great source of revenue for Medicare providers, and actually really great services to be providing to your patients anyway, because it assists them with the transition home and it helps prevent readmission. So we're going to do transitional care management for this patient. That requires us to touch base with them within 24 hours, 24 to 48 hours of their hospital discharge, and to have them in for an appointment within 1 to 2 weeks of their discharge, depending on the circumstances. So let's say in the office that we've reached out to this patient, we've got them on the phone, talked to them about their encounter, we made a follow-up appointment. We might want to go ahead at that point and categorize this patient as being in progress. The notification is in progress. And when Edward Gibbs comes in for the follow-up appointment, and we do medication reconciliation, and we answer all the questions about their hospital encounter, and we've essentially closed out this notification, we can then mark it as completed, and that will immediately move Edward Gibbs over to the completed column and completed status. And then next time we log into his notification, we can see that the status log has changed. So this is really helpful for, let's say, a physician practice where you have 3 Prompt accounts, 3 people who have care coordination responsibilities for patients that are logging into Prompt, that are working the notifications. You can see what the other members of your team have done with the notifications. And they'll also move through the queue in their Prompt accounts when they log in. So I've now moved Edward Gibbs over to completed. My teammates at the physician practice that I work at will also see that that notification has now been marked as completed. We have a couple of features that are going to be new to Prompt in Florida that are going to be rolling out soon. One of them is a notes entry capability. It's a free text notes entry field that will show up in this section of the notification. And that will allow you to, let's say I marked Edward Gibbs' notification as in progress because we made a follow-up appointment for November 25th. The free text field would let me enter in exactly that information, and it would allow the other Prompt users at the practice where I work to see that. So they know not only that the notification is in progress, they can see notes that I've entered on that notification. So that's a useful field, should be available early in 2019. We'll be rolling that out to folks. So that's the queue, kind of queue functionality that lets you work through your notifications and coordinate with other team members as you move these notifications and follow up with your patients after they've been discharged, and move the notifications from not started all the way through to completed. So another really useful feature here that I want to highlight before we wrap up with the demo is the ability to filter. So if you only have a couple hundred or perhaps even a couple thousand patients that you're going to subscribe to receive notifications on, that may be a fairly small volume of notifications. You may just get 10 or 12 a day, for example, depending on the health status of the population you're looking to cover. But if it's a smaller number of patients you're covering, you'll have a smaller number of notifications, and you may not need to filter them down. They'll populate in here in real time. You can work them in real time, and that's great. But for organizations that have a larger number of patients that they're responsible for providing care to and coordinating care as they leave the hospital, tens of thousands or perhaps even larger number of patients, that can be a high volume of notifications. And one of the pieces of feedback we received from our participants is how useful it is to be able to narrow that down to the most actionable notifications first. Let's say there's certain criteria about your patients that these are the patients, those with congestive heart failure, those with diabetes, perhaps those who are pregnant, and these are all ones that we've heard from our participants, that those are populations that to them, those are the folks they want to follow up with first. And Prompt provides the ability to do that through the filtering capabilities. So you can filter basically by any of the data elements that are in the notification. So if you wanted to filter by patient class and you just wanted to follow up initially with your inpatient, with your patients who have had inpatient care at a connected hospital, you can filter, and you notice this had over 1,000 before, now it's down to 500 because we're just looking at patients who have had inpatient encounters. If we wanted to filter it a little bit more, let's say we want inpatient encounters where the patient has been discharged to an intermediate care facility. So we want to know all of our inpatient patients who've gone to an intermediate care facility. And we can narrow it even further and say we want to know patients who were discharged from a particular facility. And I know in our test data, Sinai shows up quite a bit, so we'll say Sinai. That allows you to layer filters and get down to those notifications that are of most interest, or that you just want to look at that particular slice of data for analytics purposes or for whatever your reasoning is. And a really useful feature is that we're able to save the filter. So let's say that patients who had an inpatient status who were discharged to an intermediate care facility from a Sinai hospital, those are the ones that, to my practice, are the most important, if I could type, important notifications. I can go ahead and save that filter so that next time I log in and I want to see just my most important notifications, I can go just to those notifications. I can drill down directly to those that are most actionable, and that you can save a number of filters so you can kind of tier your notifications, do a set of tiers of filters, so that most important, second most important, or however you want to go ahead and build those filters. So the filtering capability is great. The queue filter, work queue capability is great. And again, this is just a tool set that we offer at no additional cost for practices that need some lightweight care coordination tools. We have a number of folks who just want the raw data, but as we've started to roll prompt out and do demonstrations, talk with people more about it, there's been a lot of excitement around having this tool set available. So we're happy to offer it, happy to do the demo today and answer any questions about this or about ENS. But that was high level. That's the demo. I'll go ahead and stop there so we have time for Q&A. And again, just a bookend of the presentation. None of this was real data or real PHI, and this was a test account. So Chris, I'll go ahead and hand it back over to you here.
Thanks, Aaron. That was a really nice demo of the prompt user interface. Let's see. All right, I think I've got my screen back.
I'm just having problems with mine, Chris.
Okay. All right. I'm sharing my screen again. So yeah, that was a great demo of the prompt user interface. I think it's really helpful to actually see it in action and see how it works. It can be really useful in addition to another endpoint you select. So I think Aaron said this, you can use this, and if you have a secure folder like an SFTP folder that your notifications are being dropped into, prompt is still available to you, and that is bundled with your subscription, so it's free of charge. So it can be a really powerful tool for you. Pam, before we take some questions, do you want to tell people about onboarding and some funding opportunities that are available?
Sure. So if you're watching this presentation and are going, wow, yes, our organization needs to subscribe to this. It's really easy to subscribe. There's not tons of technical stuff to subscribe your organization. You can get the first thing you would do would be to sign the ENS subscription agreement. Of course, have your legal team review the subscription agreement and terms and conditions. That document is a multi-party agreement, so no changes to the agreement can be made because all of the data sources and subscribers are agreeing to participate with each other. So we cannot make changes to the agreement. You can get a copy of that off of our website under the resources section. So under ENS onboarding, under the resources section of the website, the subscription agreement is available. And there's also an onboarding checklist, and you can go through that onboarding checklist, and it really gives you kind of a real detailed overview of all the things that you would need to do to subscribe to the service. So how to do your patient panel and all that kind of stuff is in that checklist. so you can do that. The cost for participating with ENS does vary by organization, and you can choose to end your participation at any time. So here's just a list of the costs for this service. For providers that are data sources, of course, it is going to be less expensive for them because they are sharing data, and without that data, there's no value to anybody else. For licensed healthcare providers, for physician practices, dentists, of course, the cost for that is going to be less. And then for health plans and ACOs, it's our regular charge of $1.50 for the first for patients for each patient up to $50,000, and that is an annual fee, so paid quarterly, so it will be broken up quarterly. But
since we're talking about pricing, Pam, do you want to tell people about this exciting funding opportunity that's available?
I sure do. So there is some funding available for Medicaid providers to subscribe to the service, and also to become data sources. So if you are right now we have the 215 hospitals that are sharing their patient data with us. We'd like to expand that. We'd like to include long-term care, long-term post-acute care facilities in that data, or other provider types, to get them to share their data with us. And so we do have funding to cover the cost of connecting to be a data source. It's for technical connection, so up to $5,000 per connection. And then we also have funding to cover the first year, up to 250,000 patients, of subscribing to the encounter notification service. So being able to receive that data and use that prompt interface to find out what's happening with your patient. And the reason we have that 12-month stipulation in there is so that you can begin using that service, look for the value in using the service, where and are we receiving value that would cover the cost of us using this service in the future, and looking at, okay, what patients do we really need to cover if we move forward in the future? Those kinds of questions, just to help you be able to answer those things. And if you have questions about funding and if you are eligible for that funding, you can always reach us at the email address that is on the website right now, or contact Suzanne Cryolu, and her email address is going to be coming up here pretty shortly.
All right, Pam. So yeah, that pretty much covers pricing and the funding opportunity. I want to throw this slide up on your screen. These are some use cases and some of the impact that ENS can have for return on investment. Aaron, I do want to leave enough time for questions, but do you want to briefly highlight a couple of these?
Sure, happy to. So we worked with a couple of our connected subscribers. We know there is a good ROI. We've had really brisk adoption of the service. People really like the data, but we worked with a couple of folks a little more closely to try and quantify what it was that they were getting out of the service and the value that they were getting out of it, so we could put some actual numbers to it. And we're working with some additional participants to get some new numbers, but these are the ones that we have to highlight here this morning. We have an ACO participant with us that had some direct ACO Accountable Care Organization, it's a Medicare Shared Savings Program accountable care organization that works with Medicare to generate savings that they then are able to receive part of. So we worked with one ACO that had some direct ADT feeds from local hospitals, not through us, but directly from the hospitals that were in their service area. And they realized via claims that they were missing a lot of encounters. So they subscribed to ENS, and they realized that they were missing over a third of their total patient ER utilization without ENS. So, and the claims revealed it, but they didn't have any way to get this in real time. And that's when they decided, the state HIE has basically universal hospital connectivity in Florida, and that it would be, advantageous to work with us to go ahead and get that. And as an ACO, they had a really good ROI on their participation, because these are, a third of the encounters that were occurring, they were missing. So they couldn't follow up with these patients. They couldn't provide transitional care management services. They couldn't, connect the patient perhaps with a primary care practice that was more convenient for them based on where they lived. So that's been a really great experience to work with them. There was another ACO that we worked with that had a large number, so close to 75,000, so it was over 73,000 transitional care management eligible discharges. And I've touched on TCM a couple of times during this call. Those are when a Medicare patient has a hospital encounter, if the physician can touch base with them within a day or two of their discharge and get the patient into the primary care setting within a week or two of discharge, to do medication reconciliation, to work with the patient after they've been discharged. Those services improve patient outcomes, reduce the odds of readmissions, and also are services that the practice can bill for. So one subscriber had over 73,000 TCM eligible discharges during a study period, and they really lacked awareness, right? You have 24 to 48 hours to engage with the patient after discharge. And if you don't know they've been in the hospital, that's really difficult. So they subscribed to ENS, and they were able to use the real-time data feed to get almost 70% of those patients on the phone within that 24 or 48 hours, and then in the office for a follow-up visit within that 1 to 2 week time frame. So this is really kind of the exciting content of what we're doing, right? This is great for the patients. This is really great for the patients in terms of their outcomes. It's great for the practice in terms of the ability to provide care and also to bill for it and receive revenue and have claims paid for providing those services. And we're able to enable that in our role as the HIE. So we're really excited about the role that we've been able to play in this and being able to connect new practices and new ACOs, new health systems to the services as recipients of data, so we can repeat this story for more patients and for more providers. And we're also seeing large numbers of reduced readmissions. So we had one subscriber that reported a 40% reduction in readmissions per quarter during their first year of subscribing to ENS. And how they did that was they had real-time data. They were able to follow up with their patients after discharge, understand the reason for the hospital encounter, and engage with their patients to make sure that the patient knew they had resources available outside of the emergency room setting. So obviously, if there's an emergency, we want people to go to the emergency room, but there's a fairly high number of emergency room encounters, emergency utilization that is not necessarily for emergencies. So there's definitely an education component to this, and working with patients and making sure they know that they have nurses, they have doctors available to them to assist them if it's not an emergency situation. So, but yeah, so good numbers across the board in terms of getting better data, in terms of being able to provide follow-up care as patients are discharged, and that all adding up to reduced readmissions where appropriate. So, like I said, we're excited to be a part of this story and to be with the agency enabling these great improvements in care across Florida.
All right. Thanks, Aaron. We've got about 15 minutes left, so I want to open it up to questions. For those of you who joined later on in the presentation, you can either type your question in through the control panel, or you can raise your hand on the control panel and we can phone your question in. Looks like we've already got a couple that came in while we were giving the presentation, so I want to go ahead and answer those. These are some really good general questions. We've got one about data sources and one about subscribers. So Aaron, I'm going to go ahead and ask the one about data sources to you. David here is asking, how does ENS work on the hospital side as far as data entry? So I think he's asking, how does the data get to the ENS service?
Sure, that is a great question. So As Pam mentioned before in the ENS overview, we have over 215 hospitals connected across the state, and that represents about 95% of acute care hospitals. So really good hospital coverage. But how are they getting the data to us? I think everyone will be happy with this answer. So the hospitals had, prior to the existence of the Florida HIE, the hospitals had a system in place already that tracked patient movement through the hospital. So you come into the hospital, they register you in the ER, they decide that you need to be transferred to inpatient status, and you're in inpatient status for perhaps 2 or 3 days, and then you're discharged. So the hospital already had built into their IT system a process for tracking patient movement through the health system, and it's built on standard HL7 ADT messages. And so these are standard messages that include information about the patient, about their encounter, about their current status, about the services they've received. So this already existed in pretty much every hospital in the country. And what we're doing with the hospitals that are connected to ENS in Florida is we're saying, hey, this existing flow of data within your health system, we'll set up a secure connection with you. Go ahead and send us copies of those messages. And we'll use those messages, the copies that we receive, as the basis for the notifications. So the hospitals don't have to do any of this manually. There's no duplicate work that's being done in terms of logging this information. This is all built on existing hospital workflows. So all the hospital had to do was set up that secure connection with us and start sending us copies of certain categories of notifications. So, and once all the hospitals did that, they just have to make sure that the secure connection to us is stable and that the data continues to flow. So for the hospitals, they did the initial connection, and then there's some maintenance work in terms of making sure that the feed stays connected. But by and large, they set it up and they don't have to do a lot of additional work to maintain the feed. So not a large amount of effort on the side of the hospitals to maintain the feed. It's all automated. It's all real time. So yeah, it's not a lot of additional manual work on the hospital's part. So it's a really good question, a good opportunity to clarify the process at the hospital and all of this.
Great. I'm going to go ahead and ask one more of the typed in questions, and then I'm going to move to the people who have their hand raised. Aaron, could you just address quickly any kind of HIPAA concerns, patient permission and privacy concerns?
Sure. Another really good question. So the patient's consent on the subscriber side. So as a physician practice or a health system or an ACO or a payer, you'll need to, in subscribing to ENS, and the agreement lays out the requirements around this, you'll need to have consent from the patient. So it doesn't have to be HIE specific, it doesn't have to be ENS specific. You just need consent to access the data coming across the network. Note that this is not just relying on your HIPAA treatment relationship. It does require actual signed consent. And so that's what covers the exchange of data, right? 8 million patients, 1 million notifications a month, all of it patient authorized, all of it HIPAA compliant. And because this is such an important topic, I'll just say that any follow-up questions about this, really about anything, but about this in particular, we're definitely happy to talk about this in as much detail as needed to make sure that everyone's comfortable that we're compliant with HIPAA requirements.
Great, thanks, Aaron. All right, I'm going to go ahead and unmute a couple of people so they can ask their questions. Tracy, it looks like you've had your hand raised for a while. I'm going to unmute your line, and I believe you should be able to speak your question out. Are you there, Tracy? You might have to dial in your audio pin so that your microphone works. Tracy? All right. If you want to type in your question, Tracy, maybe we can field it that way. It looks like also, Valerie, you have had your hand raised. I'm going to unmute your line if you have a question. Oh, Valerie, are you there? Looks like you have yourself on mute there. So if you do have a question, try to unmute your line. All right. Well, while we're waiting for them to maybe type in their question or get their line unmuted, Aaron, let's try a couple more of the typed in questions. So I think something that's important to address is who can subscribe. We have a couple questions. Someone's asking if this service would work with specialty hospitals, for example, a cancer facility, and someone else is asking, can substance abuse facilities utilize ENS?
Okay, good question. So the requirements to participate are that an organization be a covered entity provider. So we've had quite a few business associates engage with us over the years because we've been at this for a number of years now. And we don't contract directly with business associates on behalf of their covered entities. So we only contract with covered entities, covered entity providers. So that's the first kind of criteria. And then the secondary requirement is that the covered entity provider that wants to subscribe needs to have patient consent. So we touched on consent with the last question. You do need to have consent. So for a specialty hospital or a behavioral health provider that was interested in receiving notifications, the question would be, one, are you covered any provider? In both cases, it sounds like it. Two, do you have consent? And only those organizations would know. And then the third question would be just the value. Is there value in knowing about your patient's acute care hospital encounters? And if the answer to all three of those questions is yes, then you're welcome to subscribe. We'll be excited to start getting data to you and doing what we're doing with the other 80 some odd participants, which is improving care for your patients. So those are the three criteria: covered entity provider, consent, and value.
Awesome. Let's see, we have a prompt specific question, which I'm glad to see since we had the demo today. Aaron, are the notifications within prompt grouped by patients? For example, admission and discharge. Oh, do admissions and discharges live under the patient's card?
So yeah, that's a good question. We do receive, so I mentioned with the first question, in response to the first question, that the notifications are built in part off of the ADT messages that we receive from the connected hospitals. And within these ADT messages, there is a data element called episode ID, and that ties together all of the messages from a single encounter. So someone's admitted, they're transferred from one status to another, maybe from emergency to inpatient, and then they're discharged. Or someone's registered in the emergency room and then they're discharged. There is an episode ID that ties those events together. So someone has an emergency department encounter on Monday, and then, as sometimes happens, they return on Tuesday. Right? That's not the norm, but it's not uncommon either. We do have an episode ID that ties admit A with discharge A and admit B with discharge B. So yeah, there's a data element that does that. So if you receive the data by direct or SFTP, there is something there that you can use to tie each admit to its corresponding discharge. But we use that same data field in prompt to tie the notifications together as well. So yes, right, that queue on the left-hand side, if there's a discharge notification that comes in, the earlier admit information is there as well.
Great. Yeah, that was a really good question. Here's another really good one that's I don't think we've covered quite yet. Aaron, what EHRs can be integrated with ENS? Someone's asking, is there a complete listing of all the integrated EHR vendors?
Another good question. So, and it's funny, this is a point we should have touched on earlier. It's EHR agnostic. So the data is HL7 formatted data, or it can be, if that's how you want it formatted and that's how you want us to send it to you. And most, if not all, EHRs are going to be capable of ingesting that kind of data because it's standard HL7 formatted data, right? That's a very common healthcare standard that pretty much every EHR should be capable of ingesting. So we can work with any EHR platform. We have a lot of flexibility in terms of the formatting of the data. And then for folks who, for whatever reason, can't ingest it into their EHR or don't have good care coordination tools within their EHR, we do have prompt available. And as you mentioned before, Chris, I think it was a really great point. These aren't mutually exclusive options. So if you want a raw HL7 feed that you're going to work with your EHR vendor to import into your EHR, that's great. But you can also set up prompt accounts if you have a need for those. We have a handful of subscribers that have all three endpoints. They have direct SFTP and prompt, and they use each one for a different business need. So we can support all that, and we're happy to, as part of the onboarding process, we'll talk with you and understand your intended uses for the data and make sure that we have it set up in a way that's most useful. Yeah, but we can work with any EHR system.
Yeah, a lot of flexibility in how you receive your notifications.
Exactly.
David, looks like you have your hand raised. I'm gonna unmute you and see if you want to speak your question. David, are you there?
Yes, this is David with CMS Plan. I was wanting to ask Aaron, once the data gets sent or shot to you to AI, how do y'all incorporate data on your end?
So do you mean like what transformations do we do with the hospital data?
Right.
Right. So the data that's coming from the hospitals, right? So they're connected. It's a live feed. That's at present the sole source of data, right? So we're not adding in additional sources of data to enrich that. So, for instance, social determinants of health, right? We're not adding in outside data sources. So it's at present built solely on the hospital data. And we really don't do a lot of transformation. Actually, at present, we're not doing any transformation of the data. The data comes to us from the hospital, and we transmit it as is to the subscribing organization. We are working on a project right now to standardize discharge disposition. So we have 215 hospitals, and while most of them use the standard HL7 code set for discharge disposition, where H means home, and where there's a standard understanding of what it means, a number of connected health systems use their own code set, their own internal code set that is meaningful to them, but isn't necessarily meaningful to outside payers or ACOs or physician practices. So we've gotten code sets from a good number of connected hospitals for discharge disposition. We're working to map that so that on the recipient side, you as a provider receiving this data can make a little more sense of the discharge disposition. This is the first for the Florida HIE. This is the first time that we've done any transformation of the data. We know that there's a lot of demand for standardization, and we're starting with discharge disposition, and we'll make good progress on that. And then based on participant feedback, we'll look at other data elements that we could standardize as well. So right now we're not doing any transformation, but we're embarking on it with discharge disposition.
Thank you.
Great.
Yeah,
Thanks for your question,
Thanks,
David. All right, folks. Looks like we're up at the end of our hour here. We did have a couple more questions that rolled in. We will go ahead and email you some responses to those. And you've got all our contact information up here in case you think of an additional question. For those of you who didn't hear at the beginning of the presentation, this was recorded, so we are going to send you a link to this recording so you can rewatch it if you'd like, and you also get the PowerPoint slides sent to you as well in PDF format. Pam and Aaron, thank you both for joining us today. We got a lot of good information on ENS.
Yeah, thank you so much, Chris. Thank you, Pam.
Thank you, Aaron.
And to everybody watching and listening, thanks for joining us today, and I'm wishing everybody a safe and happy Thanksgiving. Once again, please contact us with any further questions, or if you need some additional information, please visit our website at florida-hie.net. We've got a lot of resources and some more information on there. And with that, I'm going to let everybody go for the afternoon. So have a great day, and hopefully we'll be speaking to you soon.